Vaginal discharge syndrome. Vaginal discharge syndrome is due to vaginitis or cervicitis. Causes: number 1, Candida albicans. Number 2, bacterial viginosis. Chief component for patient or sign and symptoms: number 1, vaginal discharge. Number 2, itching of genitalia. Number 3, vaginal soreness. Number 4, pain during intercourse. ट्रीटमेंट अथवा उपचार: टैबलेट मेट्रो 400 mg into TDs into 7 days. टैबलेट फ्लुकोनोजोल 150 mg PO BD into state. Number 3, Candid B6HS for 6 nights. Number 4, tablet levocetirizine 5 mg into HS into 4 days. Number 5, tablet Punto 40 mg into BD into 7 days. Advice for patient: number 1, follow after 1 week. Number 2, use of condom. Thanks and welcome my YouTube channel. And this medicine cure vaginal discharge syndrome 100% permanently.